So I think advocacy is one of our founding arms of AMDA. It's really important for us to share with the public and key stakeholders the efforts and things that we are passionate about. And so advocacy is about advocating for patients. It's about advocating for fellow colleagues. And I think we bring clinical experience as subject matter experts in various conditions that we need to share with the public and key stakeholders. I think AMDA as an organization has done a wonderful job highlighting on the federal level advocacy efforts, and on the state level we need to begin to expand those relationships with local key stakeholders, and I think the folks that we have engaged with so far have done a really wonderful job and are very open to hearing from our members and folks at the state level. So the more folks at the state level we can get engaged, they engage in local and forming relationships with how state politicians and key stakeholders, the further we will get as an organization at AMDA. So I think the biggest message that AMDA members need to share with key stakeholders, including politicians and others, is issues that they see on the ground currently within nursing homes and post-acute facilities. It's really important to share personal perspectives on what does it mean for nursing staffing standards, what does it mean to have a registry of medical directors, what does that mean for the everyday clinician, and potentially the benefits for politicians and public health officials. I think we need to bring those, the voice from the front lines and what that potential advocacy would mean or issue and how we could shape that future. So I think for folks that are reaching out the first time, I think the first advice is really find your passion. It's really hard to advocate on an issue that you are not passionate about. So, perhaps medical director registry is not your passion, but you're really passionate about improving wound care for nursing home residents. If that's a passion that you're interested in, you should go for that. So the first thing is to find your passion. I think the second thing is you need to be kind in your efforts. If you are just starting out in your advocacy efforts, you need to be very responsive to the audience that you're talking to, and you need to be kind in your messaging and understanding. Start with an open dialogue about the issue. And move forward. And then the last message, if you're just getting started, is really understand and manage your expectations. You need to understand that local advocacy and regional advocacy can take months, years to finally see an effort, and so don't expect an outcome after the first one or even two meetings. You need to develop the relationships, network, talk to folks, and make sure that you understand that my game plan is really 3 to 5 years down the road is when I want to see success, and I'm going to continue working throughout this time on that, and I'm going to network with my colleagues across the country who are doing the same thing through an organization such as AMDA. Yeah, I think in general at AMDA, our next steps as it relates to state-based advocacy is to transition our efforts from the COVID-19 state task force collaboration to our more formal public policy subcommittee. We have a state-based policy and advocacy subcommittee of the AMDA Public Policy Committee, and through that work we will continue over the next several years to highlight success stories, make resources available for local advocacy members, and to engage with AMDA's Public Policy Committee and provide a bidirectional flow of information and share successes. Together we can work this through and share our experiences.